This topic is panic disorder. The diagnostic criteria include panic attacks. These are those sudden episodes where they feel intense anxiety and feelings of impending doom. And then once the attack stops, they're worried about the next attack. When will this happen? Will I be prepared? Will I be able to take care of myself in this situation? Then the clients will avoid anything that they feel might trigger another panic attack. These episodes can last from 5 to 30 minutes. These episodes may or may not be in response to a stressor. And some clients will have one panic attack and never have another, and then other clients will have repeated panic attacks. The etiology is not entirely clear. It may be related to an imbalance of neurotransmitters, too much norepinephrine and not enough serotonin. Or it could be because of an overactive amygdala, the fear center of the brain. Some clients may experience panic attacks frequently. They can be short or long-term and also may increase with frequency and severity. This can result in long-term effects in the body. Here's an image that shows the effects of severe and then chronic stress upon the body. You have your stressor, and that activates the sympathetic nervous system. In the immediate is that increased epinephrine and cortisol. The heart rate goes up, the blood pressure goes up, and the glucose release goes up. Also with stress, that deactivates or lowers the activation of the parasympathetic nervous system. It decreases blood flow to the digestive and visceral organs. Long term, this results in increased fatigue and anxiety, increased cardiovascular disease because of that tachycardia and hypertension, and muscle tension because of that constant pain from prolonged tension. It also results in decreased function of the immune, reproductive, and digestive systems because that blood flow is decreased. No blood flow, no oxygen, less function. Let's talk about the clinical manifestations of a panic attack. Clients will have a sudden onset of extreme apprehension and impending doom. They may even feel like they're having a heart attack. So let's take a look at this. You can see here the breakdown of the autonomic nervous system, that increased activation of the sympathetic nervous system, resulting in that fight or flight response. And then the decreased activation of the parasympathetic nervous system, resulting in the rest and digest response. All of this results with the client experiencing heart palpitations or like their heart is beating out of their chest pain or discomfort, shortness of breath or feeling like they can't catch their breath, trembling hands or shaking, and then diaphoresis or shivering. The client may fear being trapped or dying. The client will receive psychotherapy in the form of cognitive behavioral therapy. This is used to reduce the client's anxiety by changing how they think about it. They are presented with something that could cause anxiety. Then they look at their response. They look at those unhealthy responses, and then they learn healthy responses to those stressors so they can replace those unhealthy responses with healthy responses. Some of these clients are prescribed pharmacotherapy in the form of selective serotonin reuptake inhibitors. This is the first line of treatment for panic disorder. It causes and results in more serotonin in the brain. Some clients are also prescribed benzodiazepines. The benzodiazepines are only given for a short term until the SSRIs are allowed to work at their peak. Benzodiazepines can be given specifically for panic attacks. The best long-term option for the client with a panic disorder is using SSRIs. What should the nurse do when a client is experiencing a panic attack? Stay with the client. You want to reassure that client that they are safe. They're in a safe place, and you might have to decrease stimuli in their environment. We'll want to speak in short, simple sentences, because this is easier for the client to understand when they're in the middle of a panic attack and their mind is racing. We want to encourage the client to do controlled breathing exercises. We want them to take slow, deep breaths. The client may be hyperventilating. going back to those clinical manifestations of the client being short of breath or not being able to catch their breath. After a panic attack, we'll want to talk with the client and see if they can identify possibly triggers or feelings that came before the panic attack. We will want to reassure the client that this happened just from their feelings, not from a medical emergency. That can be done by teaching them what are the bodily manifestations of anxiety. And then we can teach them positive talk so that the next time they feel themselves having a panic attack, they can tell themselves, I can control this anxiety. I can control my next panic attack. I can take deep breaths and I can slow my thoughts. I got this.